proper nutrition for people with renal failure. Although they are only about 4 inches in length, the kidneys work together to filter just over 18 gallons of blood every hour of the day for a total of just over 400 gallons every day. Over half of all of the fluids that are taken in by the body are filtered by these two organs and is then released as urine. During a typical day, the kidneys may produce and send about 2 quarts of urine to the bladder for elimination from the body every single day. In addition to filtering the blood to remove waste products, the kidneys are also responsible for the regulation of blood pressure and the number of red blood cells via the production of certain hormones. There are a number of conditions that can affect these organs, including kidney stones and kidney infections, which can both be temporary in nature, as well as serious conditions that can include chronic kidney disease, also known as CKD. The conditions can grow worse and may lead to renal failure. Renal failure, the cessation of kidney function, can be acute, meaning that it is sudden, and may be temporary, or chronic in nature, meaning that it can be ongoing and more permanent. There are several tests and symptoms that can indicate the possibility of renal failure in the body. Tests include blood work to check for the presence of serum creatinine and also a decrease in the glomerular filtration rate. The symptoms of kidney disease can include problems with the urine, unexpected or unexplained weight loss, and nausea. In some cases, pain in the mid to lower back may indicate a kidney disease that is either acute or chronic in nature. Kidney disease may also lead to a diffuse pain in the shoulders as well. In addition to problems related to the production and elimination of urine, kidney disease, especially once it becomes serious, may cause phosphates to build up in the blood, which in turn can cause blood calcium levels to be depleted. Potassium, which can build up in the bloodstream, may lead to abnormal heart rhythms and may progress to muscle paralysis as well. Chronic kidney disease can affect as many as 26 million Americans, with many more at high risk for developing the disease. The major cause of death for those with CKD is heart disease, and early detection of the disease itself may be the only way to stop its progression. Risk factors for CKD as well as other types of kidney disease include hypertension, gout, diabetes, prolonged shock, and the use of certain types of drugs. Other risk factors that cannot be changed include family history and belonging to certain ethnic groups. Nutritional suggestions. Some nutrients can be a major problem for people with kidney disease. For instance, limiting phosphates and potassium can be a very serious need for those who have kidney disease. In addition, during some stages of kidney disease, protein intake is limited, while in other stages the need is increased. For these reasons, it becomes very important to discuss protein and nutrient needs with your doctor before you make any dietary changes. The doctor will suggest what you need to include in your daily diet so that you can be in the best health, even when you are fighting to recover from serious kidney disease. For those whose doctors suggest a protein supplement, ProfectR from Protica is a good choice because in addition to having a high protein per serving content, there are no carbohydrates and no added fats. In addition to using nutrition as part of the treatment plan, there may be other methods of treating the condition, including dialysis, which is a mechanical means of removing the waste products from the bloodstream, performing the job that the healthy kidneys would be doing. Surgery may be necessary to treat kidney stones and blockages, but is usually not indicated for CKD. If the kidneys are bad enough, however, one of them may be removed from the body and a kidney transplant may be sought. While some patients are lucky enough to get a good match from a friend or family member, there are others who will spend months or even years on the national transplant list. Kidney disease and nutrition, a case study. Franklin has always had some issues with his blood pressure, and while he knows that he should keep better watch on it, he is not doing so well with that goal. Franklin, in addition to having blood pressure problems, is an African American male with borderline diabetes. These risk factors have put him in the latter stages of kidney disease. He has had one instance of renal failure already, but there might be additional problems that he needs to keep in mind. At first, he was limited to the amount of protein that he could have in his diet, but now that he is in the latter stages, he has been told to dramatically increase protein intake. ProfectR, being small enough to bring with him wherever he goes, is the perfect solution, allowing him to have 25 grams of protein whenever he needs without having to worry about trying to mix or store a protein shake. Franklin will have to watch some of the ingredients that are included in his foods, especially those nutrients that can cause additional problems because of his disease. Foods that are high in phosphates or potassium will only cause him further problems and should be avoided. In addition to paying closer attention to his diet, Franklin will have to monitor his blood pressure and his diabetes because both conditions can make his kidney disease progress much faster. He will have frequent checkups, including blood work, so that he can maintain control of his health.